Hey guys, it's Dr. Justin Southall and Chase Moy from Eastern Shore Chiropractic and Sports Clinic in Fairhope, Alabama. Today we're going to discuss elbow pain and some of the ways that you can treat it at home. So you may be sitting there suffering with what you call golfer's elbow or tennis elbow, which is medial epicondylitis or lateral epicondylitis in some fancy terms, but for us it's just elbow pain and it hurts. And what can you do at home to treat it? So Chase is going to demonstrate one of the most important things while you're working out, you're playing tennis, you're playing golf, any of those things, which a lot of our tennis and golfers actually don't have it. It's more of our everyday layperson. They're sitting at the desk typing on a computer, or they're just working out at the gym next door and they may have that elbow pain. So one of the first things we want to do is make sure you have a neutral grip. So when I say neutral grip, we're going to want to make sure that that wrist is not flexing. If he's doing a bicep curl, he's not flexing it, or if he is doing a pull-up, so the bar would be up, he's not stressing this joint right here. So it's a ton of stress. So rarely is the elbow the cause of the problem. Normally it's a wrist dysfunction or overcompensation, or sometimes it's a shoulder issue that's causing that pulling on that elbow. This is just the middleman. He gets blamed for everything. So, neutral grip. So if he's swinging a golf club, he's going to make sure that he's not over extending or over flexing that wrist. So that's number one, neutral grip. So if you fix a neutral grip and you still have a problem, then at home you're going to take the old trusty lacrosse ball. So Chase is going to show you what he's going to do with that. Is he's going to get into the forearm flexors and the extensors, and he's going to dig into with that ball. You can sit down and do it as well if you need to, but he is going to work that 30 seconds on each of those tender points, working that range of motion through, trying to free up any type of entrapment, any type of adhesion that may be causing some of that dysfunction. And he's going to work it all the way down to that wrist, because like we talked about, the wrist is the root of all evil sometimes. So once he gets that done, we're going to go to our trusty voodoo floss. And we have talked about this. You can get this at roguefitness.com. You want to go with, my favorite is the Exotic, the red band. It works really, really well. So you do this at the CrossFit gym, wherever you're working out. You can do it at home, but you need your husband or your wife or your partner, whoever, help you to get this on. So I'm going to put it on his elbow. We're going to start below, and we're going to apply the voodoo floss, and I'm pulling it down really, really tight, and I'm going to wrap it all the way around and get it nice and tight, and then I'm going to cross back over that elbow for the last little bit, and I'm going to tuck it in under so it stays. So we're going to leave this on for about 30 seconds up to 2 to 3 minutes. If your hand starts tingling, going numb, loses color, go ahead and take it off. If you have a vascular issue, don't do it. So we're going to work on getting that full extension of the elbow, and we also want to get that flexion all the way through there. And he's going to work that by himself, or you can have your husband, wife, whoever help you out with that. So I'm extending, getting that full extension, and it's going to stretch all the way through there. While he has this on, I'm going to show you what you can do with a band at your gym or at your house as well. So we're going to take that band, and he's going to have it attached to somebody, or your husband, wife, they can help you. We're going to work on extending that. Just a little bit of pressure just extenuates that extension, helping to free up any adhesion. Very good. Take this off. So again, like we talked about, maybe off of you. So again, like we talked about the wrist being the big problem, we're also going to do the same thing with the wrist. So we're going to start down right at the base of the hand, right where it connects, nice and tight all the way through here, pulling it through. And again, this is going to cut off a little bit of circulation, but we want that because it's going to stop the blood flow, and when it rushes back in, what it's going to do is it's going to remove that white blood cell that's causing inflammation. And I'm just going to put that in his hand. He's going to hold on to that. And the same thing, we're going to work on extension and flexion of that, breaking up any adhesion that we got through here. And then the same thing with the band. We're going to take it, we're going to put him in extension, and we're going to distract and pull. He's getting that full extension of the wrist. This should not be very painful. It should just feel like a really good stretch. And we're going to take it around the other way. Actually, we'll switch like that. Keep it. And we're going to distract, and we'll drop it down a little bit more. And he's going to get a really good flexion stretch. It's going to really lengthen all these muscles through here, which is going to be really, really important for reducing that elbow pain. I'm going to take that off. So as you can see, his hand's a little white. And as he takes that off, the blood is going to return. It's going to flush that white blood cell out. Those lymphocytes. It's going to get you feeling a good little rush to the hand. So if you tried these three things that we showed you, you're still kind of having some pain, there's one more trick up our sleeves that we really like. So go on Amazon, go on Rogue Fitness. It's called the Arm Aid. Go ahead and put that on. Rogue Fitness has it on their website. I've used it for the last 5 or 6 years because I'm constantly using my hands, because we specialize in active release and fascial distortion. So we're always using our hands on patients, always gripping it and getting those muscles and just fired up. So he's going to apply this, straps to the wrist so you can control the tension, and he's going to give it a little squeeze, and he's going to work those extensor muscles with these balls right here. It's going to free up those adhesions. It's going to release any type of scar tissue, any type of spasm he may be having. It's going to help to free it up. Pull it out, and then he can spin it around, and he can get his forearm flexors as well, which is going to open up extension, and it's going to help with that golfer's elbow that you may be experiencing. Very good. So if you're having elbow pain, if you're having any type of outside pain through here or in here, check these drills out, try them out. It's going to make a world of difference. If not, give us a call. It's what we specialize in. So tune in next week. I'm going to show you how to make our famous protein waffle. It's going to be a little bit different from pain. We're going to be talking about nutrition and how you can make a go-to waffle that is clean, it's healthy, and it's delicious. Even my kids like them. So, Dr. Justin Southall, Chase Moy, we're Eastern Shore Chiropractic and Sports Clinic. It's your Fairhope chiropractor, and it's your life. Live it in health.